In a world increasingly focused on health, millions suffer from a condition they may not even know they have. Hashimoto's disease, an autoimmune disorder affecting the thyroid gland, impacts an estimated 14 million people in the United States alone. Despite its prevalence, Hashimoto's often goes undiagnosed for years, leaving individuals struggling with debilitating symptoms. This silent epidemic underscores the need for greater awareness and understanding of Hashimoto's disease. With early detection and proper management, individuals with Hashimoto's can live full and vibrant lives. As a pharmacist who struggled with Hashimoto's for years, I understand the frustration and despair that often accompany this condition. My journey led me to dedicate my career to researching and educating others about Hashimoto's, empowering patients and healthcare providers alike. Managing Hashimoto's requires a multifaceted approach that includes conventional medicine, lifestyle modifications, and understanding the body's interconnected systems. This holistic perspective acknowledges that Hashimoto's is a complex autoimmune disorder with far-reaching implications for overall health. We will provide practical tools and strategies to manage your condition and improve your symptoms. Hashimoto's disease targets the thyroid gland, with the immune system mistakenly identifying it as a threat. This leads to a chronic inflammatory response, gradually destroying thyroid tissue. The result is impaired thyroid function, responsible for the wide range of symptoms experienced by individuals with the condition. The thyroid gland, located in the neck, acts as the body's master regulator of metabolism. It produces hormones essential for regulating energy production, temperature control, heart rate, growth, and mood. When the thyroid is under attack in Hashimoto's, its ability to produce these vital hormones is compromised, affecting the entire body. In Hashimoto's, the immune system's attack on the thyroid involves various immune cells and antibodies. T cells, crucial for recognizing harmful pathogens, mistakenly identify thyroid components as invaders. B cells produce antibodies that target the thyroid, contributing to the destruction of thyroid cells and hormone disruption. The immune system's assault on the thyroid leads to a decline in hormone production, causing hypothyroidism. This hormonal imbalance disrupts various bodily functions, leading to symptoms like fatigue, weight gain, depression, and sensitivity to cold. Understanding these effects is crucial for developing effective treatment strategies. Hashimoto's often presents with subtle symptoms, leading to delayed diagnosis. Recognizing common symptoms is crucial for early detection and intervention. Fatigue, a persistent lack of energy, is a prevalent symptom. Weight gain, often unexplained by diet or exercise, is another common sign. Depression and mood swings are frequently reported due to hormonal imbalances. Constipation, resistant to remedies, arises from slowed bodily functions. Hashimoto's can manifest in surprising ways, affecting various bodily systems. Dry skin and hair, often overlooked, are symptoms of hormonal imbalances. Sensitivity to cold stems from slowed metabolism. Muscle and joint pain, mistaken for arthritis, can result from chronic inflammation. Irregular menstrual cycles and fertility issues also indicate hormonal imbalances. Understanding these symptoms helps in accurate diagnosis and advocacy for health. Hashimoto's symptoms can significantly impact daily life, affecting work, relationships, and overall quality of life. Persistent fatigue and brain fog make it challenging to focus and maintain a regular work schedule. Depression, anxiety, and mood swings strain relationships, leading to isolation. Social activities become difficult to enjoy due to fatigue and potential embarrassment. The unpredictable nature of symptoms adds to the emotional burden. Early diagnosis, effective treatment, and ongoing support are crucial for managing the condition. Research points to a complex interplay of genetic predisposition and environmental triggers as key drivers of Hashimoto's. Multiple genes, involved in immune system regulation, contribute to susceptibility. Family history is a strong indicator of genetic predisposition. Environmental triggers play a critical role in activating genetic vulnerabilities. Environmental triggers, such as infections and dietary factors, activate the immune system, leading to Hashimoto's. Viral and bacterial infections may trigger molecular mimicry, causing immune attacks on the thyroid. The Epstein-Barr virus is linked to an increased risk of Hashimoto's. Understanding these triggers helps in developing prevention and treatment strategies. Lifestyle factors, including diet, exercise, stress, and sleep, influence the risk and progression of Hashimoto's. Gluten may increase intestinal permeability, triggering immune responses. Iodine intake and goitrogenic foods also impact thyroid function. Making informed lifestyle choices supports immune health and symptom management. Certain groups face a higher risk of developing Hashimoto's. Women are significantly more likely to develop the condition than men. Age plays a role, with most diagnoses occurring between 30 and 50. Family history of autoimmune diseases increases risk. Individuals with other autoimmune conditions are also at higher risk. Understanding these risk factors promotes early detection and targeted prevention strategies. Section 1. Unmasking the culprit. Recognizing the signs and symptoms. Diagnosing Hashimoto's disease often feels like piecing together a complex puzzle, as its symptoms can mimic other conditions. The journey to diagnosis begins with recognizing something doesn't feel right and seeking medical attention. A thorough medical history is crucial. The healthcare provider will inquire about symptoms, duration, and any patterns. They will also ask about any personal or family history of autoimmune diseases. A comprehensive physical exam is essential. The healthcare provider will examine the thyroid gland for enlargement or nodules. Based on findings, they will order specific laboratory tests to confirm or rule out Hashimoto's disease. Section 2. Decoding the immune system. Utilizing blood tests for diagnosis. Blood tests play a pivotal role in diagnosing Hashimoto's disease, providing valuable insights into the function of the thyroid gland and the presence of autoimmune activity. These tests measure the levels of specific hormones and antibodies in the blood, offering clues about the underlying cause of an individual's symptoms. Understanding the different blood tests used in diagnosing Hashimoto's is crucial for both healthcare providers and individuals seeking to understand their health. One of the primary blood tests used to diagnose Hashimoto's is the thyroid stimulating hormone, or TSH test. TSH is a hormone produced by the pituitary gland in the brain that signals the thyroid gland to produce thyroid hormones. In Hashimoto's, as the thyroid gland is gradually destroyed by the autoimmune attack, its ability to produce thyroid hormones declines. In response to this declining hormone production, the pituitary gland releases more TSH in an attempt to stimulate the thyroid. Therefore, an elevated TSH level is often an early indicator of Hashimoto's disease, even before an individual experiences noticeable symptoms of hypothyroidism. Another essential blood test is the free thyroxine, or FT4 test, which measures the level of active thyroid hormone in the blood. In Hashimoto's, as thyroid function declines, FT4 levels often drop below the normal range, confirming the diagnosis of hypothyroidism. Section 3. A glimpse inside. Employing imaging studies for confirmation. While blood tests are key for Hashimoto's diagnosis, imaging studies offer a visual glimpse into the thyroid's structure and function. Ultrasound is a common, non-invasive procedure using sound waves to create detailed thyroid images. It can detect changes in size, shape, and tissue appearance, indicating inflammation and damage. Another technique is the radioactive iodine uptake test, showing thyroid function and iodine distribution. In Hashimoto's, this test may reveal decreased iodine uptake, indicating reduced thyroid function. Section 1. Conventional Approaches. Thyroid Hormone Replacement Therapy. In conventional medicine, the cornerstone of Hashimoto's disease treatment is thyroid hormone replacement therapy. This approach aims to replenish the thyroid hormones that the body is no longer producing sufficiently due to the autoimmune attack on the thyroid gland. By restoring thyroid hormone levels to a normal range, this therapy helps alleviate the symptoms of hypothyroidism and improve overall well-being. Levothyroxine, a synthetic form of the thyroid hormone thyroxine, is the most commonly prescribed medication for Hashimoto's. This medication is taken orally, usually once daily, and works by replacing the missing T4 hormone, which the body then converts into the active hormone, triiodothyronine. The dosage of levothyroxine is individualized based on factors such as the severity of hypothyroidism, age, weight, and other medical conditions. Regular blood tests are essential to monitor thyroid hormone levels and adjust the medication dosage as needed to achieve and maintain optimal hormone balance. While thyroid hormone replacement therapy is generally safe and effective for most individuals with Hashimoto's, it's crucial to work closely with a healthcare provider experienced in managing thyroid disorders. Finding the right medication dosage can sometimes be a process of trial and adjustment, as individual responses to medication can vary. It's essential to communicate openly with your healthcare provider about any side effects you may experience, as well as any changes in your symptoms or overall health. Beyond medication, lifestyle modifications are equally crucial for supporting overall health and well-being in managing Hashimoto's disease. Adopting a holistic approach that addresses diet, exercise, stress management, and sleep hygiene can significantly impact the severity of symptoms, improve energy levels, and enhance quality of life. These lifestyle changes empower individuals to take an active role in managing their condition and support their body's natural healing processes. One of the cornerstones of a Hashimoto's friendly lifestyle is adopting a nutrient-dense, anti-inflammatory diet. This dietary approach focuses on consuming whole, unprocessed foods, such as fruits, vegetables, lean proteins, and healthy fats, while minimizing processed foods, refined sugars, and unhealthy fats. Some individuals with Hashimoto's find that eliminating gluten, a protein found in wheat, barley, and rye from their diet, improves their symptoms. Gluten has been implicated in increasing intestinal permeability, which may contribute to autoimmune reactions. Working with a registered dietitian or a healthcare provider knowledgeable about Hashimoto's can help individuals create a personalized meal plan that meets their nutritional needs and supports their overall health. Exploring complementary therapies. Many individuals with Hashimoto's find relief and support through integrative approaches. These methods aim to address the root causes of Hashimoto's, reduce inflammation, modulate the immune system, and promote overall well-being. While more research is needed to fully understand the efficacy of some complementary therapies, many individuals report significant improvements in their symptoms and quality of life when incorporating these approaches into their treatment plans. Acupuncture, an ancient Chinese practice that involves inserting thin needles into specific points on the body, has shown promise in reducing pain and inflammation associated with Hashimoto's. Studies suggest that acupuncture may help regulate the immune system, reducing the autoimmune attack on the thyroid gland. Yoga, a mind-body practice that combines physical postures, breathing exercises, and meditation, has been found to reduce stress, improve sleep quality, and enhance overall well-being in individuals with Hashimoto's. Stress management techniques, such as mindfulness meditation, deep breathing exercises, and progressive muscle relaxation, can help regulate the body's stress response, which plays a role in autoimmune diseases. Chronic stress can exacerbate Hashimoto's symptoms, so incorporating stress-reducing practices into daily life is essential for managing the condition effectively. Navigating the world of Hashimoto's treatment can feel overwhelming, with a wide array of conventional and complementary approaches available. It's crucial to remember that there is no one-size-fits-all solution, and the most effective treatment plan is often a personalized one that considers an individual's unique needs, preferences, and health history. Open communication with a healthcare provider experienced in managing Hashimoto's is essential for making informed decisions about treatment options and developing a comprehensive plan that supports both physical and emotional well-being. When considering treatment options, it's essential to weigh the potential benefits and risks of each approach, taking into account individual health factors and preferences. Some individuals may prefer to start with conventional medical treatment, such as thyroid hormone replacement therapy, while others may choose to explore complementary therapies first or in conjunction with conventional care. It's important to have realistic expectations about treatment outcomes, as Hashimoto's is a chronic condition that requires ongoing management. Regular monitoring of thyroid hormone levels through blood tests is crucial for ensuring that medication dosages are appropriate and that treatment goals are being met. Lifestyle modifications should be viewed as an integral part of Hashimoto's management, as they can significantly impact the severity of symptoms and overall well-being. Support groups and online communities can provide valuable connections with others who understand the challenges of living with Hashimoto's, offering a sense of community and shared experience. While the journey with Hashimoto's disease presents unique challenges, it's essential to remember that a diagnosis is not a life sentence. With careful management, individuals can live full and vibrant lives. While there is no cure, ongoing research explores potential breakthroughs in treatment and prevention. Scientists are working to understand autoimmune triggers and develop targeted therapies. Emerging research includes the gut microbiome and personalized medicine. Knowledge is the most powerful tool. Understanding Hashimoto's empowers individuals in their healthcare journey. Early detection allows for timely intervention and management. Partner with knowledgeable healthcare providers and embrace a holistic approach. The journey with Hashimoto's can be one of resilience and hope. Remember, you are not alone in this journey. Connect with others and celebrate each step forward.